Have your legs been cramping lately, even when you're just walking to the mailbox? Do your feet feel colder than usual, even when the room is warm? Or maybe that sore on your toe just won't heal. Believe it or not, these could be early signs that your heart is struggling to send blood to your legs and feet. This condition is called peripheral artery disease, or PAD for short, and it's more common and more dangerous than many people realize. It happens when arteries in your lower body become narrowed or blocked due to plaque buildup, cutting off blood flow. Not only can it cause pain and discomfort in your legs, but it's also a serious red flag for heart attack, stroke, or even limb amputation if left untreated. And the scariest part? Many people ignore the early signs, thinking it's just part of getting older or from being out of shape. So in today's video, we're breaking down 10 subtle but important warning signs that your heart arteries may be blocked, starting from your feet up. If you or someone you love has leg pain, cold feet, or strange skin changes, don't skip this. Let's dive in. Sign 1. Leg or thigh pain when walking. If you start to feel cramping, tightness, or pain in your legs after walking just a short distance, this could be more than just muscle fatigue or aging. This symptom is known as intermittent claudication, and it's one of the most common early signs of peripheral artery disease. While the pain typically starts in the calf, it may also affect other areas like the thighs, hips, or buttocks. It happens because your muscles need more oxygen when you're active, but narrowed or blocked arteries can't deliver enough blood to meet that demand. As a result, your muscles start to ache or cramp, especially during physical activity like walking or climbing stairs. What's unusual about this pain is that it typically goes away when you stop moving and rest, only to return once you start walking again. People often mistake it for arthritis or just being out of shape, but if it consistently shows up during movement and disappears with rest, it's often a sign of a vascular issue. Sign 2. Slow healing cuts or wounds. If you have cuts, blisters, or sores on your feet or legs that take a long time to heal, or don't heal at all, it may be a warning sign of poor blood circulation. Healthy blood flow is needed to deliver oxygen and nutrients that repair damaged tissue. When arteries are blocked, even small wounds may struggle to heal properly. This impaired healing increases the risk of infection, which can worsen quickly. In more advanced cases, untreated injuries can turn into painful ulcers or open sores that resist normal treatment. If circulation remains poor, the tissue may begin to die, a serious condition known as gangrene, which can require surgery or even amputation in extreme situations. So if you notice wounds that aren't healing like they should, don't ignore them. While good hygiene, protective footwear, and preventing injury are helpful, it's crucial to treat the underlying issue. Sign 3. Cold feet or legs. When circulation is reduced, one leg or foot may feel noticeably colder than the other, even when both are exposed to the same temperature. This happens because narrowed arteries can't deliver enough warm, oxygenated blood to the affected area. While the difference in temperature might be subtle, persistent coldness, especially in the toes or foot, should not be ignored, as it may point to a circulation issue. Poor blood flow can also cause numbness, discomfort, and in severe cases, tissue damage. You can check by feeling both legs with your hands. If one consistently feels cooler, it's a red flag. Though wearing socks or applying warmth might offer short-term comfort, it won't fix the root cause. It's important to seek medical attention, especially if the coldness is accompanied by symptoms like pain, discoloration, or non-healing sores. Sign 4. Weak or absent pulses. One of the most telling signs of blocked arteries in the legs is a weak or completely absent pulse in the ankles or feet. Just like doctors check your wrist or neck for a pulse, they can also check the arteries in your feet to see how well blood is flowing to your lower limbs. If the arteries are narrowed or blocked by plaque, the blood flow becomes so restricted that the pulse in your ankle becomes faint or disappears altogether. You might not notice this symptom yourself, since most people don't regularly check their ankle pulses. However, a healthcare provider can check it by feeling your pulse or using a handheld Doppler device. If the ankle pulse is weaker than the one in your arm, it could point to peripheral artery disease. It's a serious warning that your arteries are struggling and may need medical attention before the problem worsens. Sign 5. Hair loss on legs and feet. Hair follicles are just like any other part of your body. They need a steady supply of oxygen and nutrients from your blood to grow and stay healthy. When arteries become narrowed or blocked due to plaque buildup, blood can't reach those tiny follicles efficiently. As a result, hair stops growing. Alongside hair loss, the skin may begin to look unusually smooth, thin, and shiny. This happens because the lack of proper blood supply affects not just the hair follicles, but also the skin cells themselves. The skin may also become more fragile, dry, or prone to cracking. In more advanced cases, it might even feel tight or look pale and stretched, making it more vulnerable to injury or infection. Sign 6. Numbness or tingling. When your arteries are blocked or narrowed, your legs and feet may not be getting enough oxygen-rich blood. This lack of circulation doesn't just affect muscles, it affects your nerves too. And when nerves don't get enough oxygen, they stop working properly. That's when you begin to feel that numbness, tingling, or occasional weakness, usually in the lower legs, ankles, or feet. This can lead to issues with coordination, making you more prone to tripping or falling. As the condition worsens, it may become difficult to stand for extended periods, and the pain might continue even during rest. Sign 7. Slow-growing toenails. Your toenails might not be the first thing you associate with artery health, but they can be surprisingly revealing. If your toenails are growing much slower than usual, appear thickened, yellowish, or have become dry and brittle, poor blood circulation could be the culprit. Healthy nails need a steady supply of oxygen, nutrients, and minerals to grow and stay strong. But when arteries are narrowed due to plaque buildup, that blood flow is reduced, causing nail growth to slow down or stop altogether. Next at number 8, erectile dysfunction in men. Healthy blood flow is essential for an erection, but when arteries become narrowed or clogged, that flow is reduced. Since the penile arteries are much smaller than those in the legs, they're often the first to show signs of trouble. In many men, ED shows up years before symptoms like leg pain or cramping begin. That's why doctors now view ED as a potential early marker for peripheral artery disease and even future heart disease. If ED is ongoing, especially with symptoms like cold feet, slow nail growth, or leg discomfort, it may signal deeper vascular issues. It's not just about sexual health, it's about heart health too. Sign 9. Change in skin color. If the skin on your legs or feet starts changing color for no obvious reason, it might be a sign that your blood isn't circulating properly. A healthy leg should have a consistent natural tone, but when arteries are narrowed or blocked, less oxygen-rich blood reaches the skin, leading to noticeable discoloration. You might see your skin turn pale or white when your leg is raised, or shift to a bluish or purplish-red shade when it's lowered or at rest. This happens because oxygen-starved tissues respond differently depending on your position. When the blood struggles to move through blocked arteries, gravity plays a bigger role, causing blood to pool or drain more easily, which changes how your skin looks. These color shifts might come and go, but if you're noticing them regularly, especially in the feet or toes, it could be a sign of peripheral artery disease. Sign 10. Muscle atrophy or shrinking muscles in the legs or feet. Noticing that one leg looks thinner or weaker than the other? That could be muscle atrophy, a warning sign of poor circulation. When arteries are narrowed or blocked, your muscles don't get enough oxygen and nutrients, leading them to slowly waste away. You might not feel sharp pain, but signs like weakness, balance issues, or leg discomfort can creep in. Muscle loss in the legs or feet often points to advanced peripheral artery disease and means blood flow has been reduced for some time. If you're seeing these changes, don't ignore them. Your arteries may be sending a distress signal. The good news is, there are simple things you can start doing today to support healthier arteries and better blood flow. First, try to move your body every day. Something as simple as a brisk 30-minute walk can make a big difference. Quit smoking if you haven't already. Nothing damages blood vessels faster than tobacco. Keep your blood pressure, blood sugar, and cholesterol levels in check with a balanced diet that includes fruits, vegetables, healthy fats like olive oil, and lean protein. Staying well hydrated also helps your blood flow more smoothly. And don't forget to manage stress. Chronic tension can tighten blood vessels over time. And finally, keep an eye on your symptoms and seek medical advice. Catching issues early and making these small steps can help keep your arteries clear, your legs strong, and your heart protected. If this video helped you better understand your symptoms or gave you something to think about, please give it a like, Hit subscribe and share it with someone who might need this information too. Let's keep learning and staying healthy, together. Thanks for watching, and I'll see you in the next video.